For many people, an appointment at the memory clinic is the first step in learning that they or their loved one has dementia.
He says his memory's a bit funny. Perhaps we'll refer him to the memory team. And I knew nothing about procedures or Alzheimer's or anything. I thought, perhaps he'll refer us to some memory training nurses and that'll be fine. And that was that. And we got an appointment with the memory team. And Tony Bayer said, well, I suppose you're thinking Alzheimer's, are you? And I thought, well, no, there's nothing wrong with his memory. His memory is better than mine. And then having a long discussion with Tony Bayer, I thought, at last, somebody knows what I'm talking about.
Well, you go to the memory clinic and, to be honest, I think she was quite excited. I can picture her now, her and my dad in the waiting room. And they interview myself and Dad first, and then they interview Mem, or you go into two different rooms. And, it was fascinating because they would ask her, who was the Prime Minister and what year was it and things like that. And she was quite, she was quite good in the beginning. And she'd say, that man, she was quite funny. But when it came to telling the time, drawing a clock, I think that was when I was kind of realised, like she would draw the face of a clock and then the numbers beside it, or it was just skew if it didn't really, it's something that we all grow up being able to do so easily, was a real challenge for her.
The link between memory clinics and primary care is an important one. So, what is the role of the memory clinic?
NICE recommends that all patients with suspected dementia should be referred to a memory clinic for assessment and the appropriate investigations and diagnosis and then appropriate management. The average GP is actually going to only have 2, 3, maybe 4 new cases of dementia a year, and clearly it's very difficult to build up an expertise with that, whereas the memory clinic will be seeing several hundred.
At what point do you think it would be helpful for a GP to decide to refer someone to the memory clinic?
If a GP suspects dementia, if the family are concerned about dementia, less commonly if the patient themselves is concerned about symptoms, well, that's the time to refer. There's no point in waiting until the GP is confident that that is definitely the diagnosis. It gives an opportunity for a proper assessment. The patient can be reassured, and whatever the cause of the problems is can be treated, or if it does turn out to be a dementia, well, then appropriate interventions can be started.
Do you have a sense of why GPs would err on the side of not referring?
Dementia and particularly Alzheimer's disease have perhaps overtaken cancer as some of the most feared conditions, particularly in those over 50, 55. And many GPs are approaching that age group, and so none of us actually like the thought that we might be losing our mental abilities. So there's a natural caution in actually really identifying a diagnosis that is seen as bad news. There's the awkwardness of how one actually communicates it, and there's a feeling that nothing can be done, which of course is totally wrong, because there are lots of useful interventions that can be put into practice and make sure that people are managed well rather than managed badly.
So I'm imagining that at the first sign that something might be amiss, within the practice things are being referred on and people are being referred to the memory clinic. What's the outcome of that?
The important thing is not necessarily to focus on an early diagnosis, it's to focus on a timely diagnosis. So the time at which the symptoms are beginning to cause concern to the patient or their families, that's the time to actually look into the cause and therefore start treating it. What
would you suggest would be the triggers for a a referral back to the memory clinic?
The aim of memory clinics and timely diagnosis is to make breakdown and crises less likely. And so rather than waiting for a crisis to happen, is if things are changing, if there are issues around people's behaviour, if they're not coping so well, and there's a need for advice and signposting to the most appropriate support services, well, that would be a time perhaps to ask for guidance from the memory clinic services.